Good afternoon. So welcome to Tuesday Reading Live. This is me, Vandana PS, joining you from Neethu's Academy. So like always, we will start with a sample question from part B. So I'll give you 2 minutes for the preparation of this particular question, then we will move to the answer. So here comes the question. Okay, so coming back to the question, a sample question from part B. Okay, so question is like, the policy extract tells us that. Okay, so this question comes from which category? Any idea? Out of the 3 categories, in which category the question comes from? Okay, hi Betty, how are you? Okay, Reshma, Sobi, good afternoon guys. Any idea in which category the question falls under? This particular question, a sample question from part B. So in which category the question falls under? Hi Archana, good afternoon dear. Any idea the category of question? Okay, so this particular question comes under the category, second category, okay, which is a policy. So second category, that is policy. Okay, and what are you reading for in a policy? So what is a policy? Any idea what is a policy? What is the difference between guidelines and policies? So always you have this concern or doubt regarding what is a guideline and what is a policy. So guidelines are different from policies. So what are policies? So policies consist of only one particular act or one particular rule, one regulation, one principle. Okay, when you compare with guidelines which means a set of rules and regulations that someone has to follow, and in policy same like okay, so that is all about the second category. Okay, so what are the keywords from the question? So what are you reading for in a policy? Okay, you are reading for the main idea. Okay, Reshma, guidelines, details and policy about a particular act. Okay, for example, Animal Research Act. Okay, so policy is all about a particular act or a code of conduct or a particular principle, information, something. Okay, and someone has to follow. That is also compulsory. Then, what are the keywords from the question? What are the keywords from the question? Okay, so the keywords which are policy, then extract, that. So these are the keywords from the question. Okay, so before that, may I ask you a question? Is it visible for you? That slide is visible for you? The screen is visible? Let me know in the comment. Is that screen is visible for you? I hope it is yes, right? Okay. Yes, so these are the keywords from the question. So we are reading for main idea. Okay? Okay, Betty, thank you so much, dear. Okay. So option A, when you read a question, as you know, you can connect with each of your options. So policy extract tells us that all hemophilia patients must be treated in a registered HTC. So my keywords, all patients, then must be. So these are my keywords from option A. And option B, the policy extract tells us that only hemophilia patients with a factor level above 30% need to be treated in a HTC. So my keywords, only, patients, then above 30%. So these are my keywords from option B. And what about option C? Policy extract tells us that the risk of being treated in a non-HTC facility have to be conveyed to relevant hemophilia patients. So my keywords, risk, then treated, as well as non-HTC. So these are my keywords from these 3 different options. Okay, and let me know in the comment box what is your answer for this particular question. Any idea? What is your answer? The policy extract tells us that dash. So what is it? What is your answer? Let me know in the comment. Okay, Vaishnavi, it is for main idea. We are reading a policy. Yeah, it's for main idea. Okay, Archana, main idea. Yes, Reshma, guidelines, details and policy about a particular act. Okay, okay, yes, it is visible, right? Okay, thank you. Yeah, so what is your answer here? An idea? Your answer for this particular question. Okay, so you guys can take almost 2 minutes for the completion of one question and you have total 6 questions. Okay, and what about the timing? It's all about maximum you can take 12 minutes. Okay, 12 minutes for the completion of one question. Clear? So that's all about the timing. And what strategy we are using here to complete part B? The strategy that's called elimination method or elimination strategy. So what is elimination method? We are removing certain options and we are finding out the correct answer. So we have some probabilities here or some possibilities here with the options. Maybe option 1 will be, one of the option will be not mentioned. And one option will be contradictory option, or I can say opposite option, and you have the correct answer. Okay, and it can vary, these possibilities can vary according to the questions. So here let's see which one is not mentioned or contradictory option, okay, or what is the correct answer here. Okay, so what about your answer? Have you all done this question? So let me know in the comment what is your answer for this particular sample question. Okay, so let me read the paragraph. Okay, either you can read the question, then the paragraph and the options, or you can read the question, then the options and the paragraph. So whatever it is, it's important we need to find out the correct answer through the method elimination. Okay. Okay, Reshma, your answer is C, right? Option C. Okay, what about Sobi? It's option A. Okay. And Matthew, it's option C. Okay, dear. Okay, any other answers, anyone? Other than C and A? Anyone with option B? No. Okay, so let's see. So what is the paragraph? Management of hemophilia and related bleeding disorders. In the interest of patient safety, patients with factor 8 greater than 30%, then factor 9 greater than 30%, factor 11 greater than 30%. Von Willebrand factor activity less than 30% and other rare bleeding disorders. Okay, it is not greater, sorry, it is less than 30%. Then should have elective surgery performed in a designated hemophilia treatment center, that is HTC, registered HTC. Since they are high risk patients, if the patients comes under the category high risk patients, then they should be, should have elective surgery performed in a HTC center or HTC. Okay, if the patients are high risk patients with an increased tendency to bleed, if the condition is very bad, then you can suggest there. Okay, and late, and they are require management by clinicians experienced in managing hemophilia and related bleeding disorders. Then what about the next one? If a patient has a factor level that is over 30%, which is greater than 30%, then and there is a specific reason for a procedure to be conducted at the hospital that is not a designated HTC. If it is not a registered or designated HTC, then what is next? The parent or the parents or carer must be made aware of the potential risk attached to having surgery in a hospital that is not a designated or affiliated HTC, and the Hemophilia Advisory Council Committee must be advised. So if it is not under a registered HTC, you should inform their parents or the caregivers. That is compulsory, and that is the policy document it's all about. Okay, so what about option A? Then we will read the options. Okay, once again, all hemophilia patients must be treated in a registered HTC. Where is it mentioned? All the patients should be, okay, so must be, which means it is compulsory. You have to give treatment to all hemophilia patients in a registered HTC. It is not mentioned anywhere. Actually, we can say it's contradictory. Okay, because not all hemophilia patients, only those patients under risk. Clear? So that you can eliminate option A. I eliminated option A. Clear, so B? Okay, we can eliminate option A, that is contradictory option. Then what about option B? Only hemophilia patients with a factor level above 30% need to be treated in a HTC. What about option B? Okay, factor level above 30% is mentioned here, over 30%. What is mentioned here? If a patient, okay, if a patient, that is probability, if a patient has a factor level that is over 30% and there is a specific reason for doing so. Okay, so not only hemophilia patients, it is not mentioned anywhere. So I'm just eliminating option B because it is not mentioned anywhere in the paragraph, only hemophilia patients. Okay, so my answer is, whether you like it or not, it's option C. The risk of being treated in a non-HTC facility have to be conveyed. You should inform them, convey to the patient's parent or caregivers. Okay, to relevant hemophilia patients. So that is the correct answer, which is mentioned in the last para, especially in the second and third lines. Okay, so our answer is option C. I hope it is clear. Any doubts? Okay, so B. Okay. Any doubts, anyone? Okay, so a lot of correct answers. Okay, Reshma and Matthew, Litty, Manu, yes. Okay, Shiny. Okay, so that is all about C. Okay, so any doubts regarding part B? I hope it is clear for you. Then we will move on to the next important material, which is from part A, a new topic. Okay, so that is molar pregnancy. Okay, so what about part A? And I think already this part A 1 to 7 set of questions which are little bit difficult, but still it's a very good material. Okay, so let's check what are the chances, okay, that you can get 7 out of 7. Okay, yeah. Okay, and the most important thing is that I can say part A will be a play with synonyms. So what do you mean by a synonym? Synonym which means the same meaning but different words. Okay, then tell me, what do you know about part A? That same typical question from my side, and what is your answer? Okay, so today I hope you guys will answer to all of the questions correctly, and I just want to know what are the 13 keyword strategy that you know. Okay, so part A, as you know, it's all about, we have 20 questions, and total we have 15 minutes. Okay, so these 20 questions can be categorized into 3 different groups. So that is 1 to 7, it's match the following. Then 8 to 14, as you guys know, it's that of, right? So that is short answer questions, and the rest of the questions, it is 15 to 20, which are fill in the blanks. Right? Okay. Yes. Then what is next? What is the next important thing? Okay, so we discussed about the time, the number of question, then categories of question, then what is next? Okay, so what about the important idea or instruction, I can say, instruction that you have to take care when you read each of the questions, pattern of questions. Okay, so in the first set, 1 to 7, match the following. What is the important thing? You don't have to write that exact answer there. Instead, just find out in which text the answer is from, whether it is from A, B, C or D. Okay, that is the first thing. Then from 8 to 14 set of questions, here you can write answer in a word or a short phrase. So after the updation of OET, it is important that you don't have to repeat any single word from the question into your answer. Clear? So when you guys do additional materials, you can see a lot of materials or the answer keys that repeat the answers, the exact same word from the question into answer, and that is completely wrong. Okay, so you don't have to repeat it, right? Okay, so you can write it in a word or a short phrase, which means maximum 3 words. Okay, so phrase, which means combination of different words. It can be 4, 5, 6, okay? But short phrase, which means maximum 3. Clear? Okay. And what about the next important thing? Okay, it's all about the strategy that we are using. So I've given a clear picture regarding what is the strategy in the previous class. If you haven't seen that particular live session, so please do watch, okay? Yeah, so what about the strategy we are using? So we are using the strategy called skimming and scanning. Okay, that is the only strategy which will help you to complete this particular part, right? So what is skimming and scanning? And you have heard a lot about skimming and scanning through different videos, right? Okay, so what is skimming and scanning? Skimming, which means fast reading. If you know the language, yes, fast reading. So only through constant practice, you guys can speed read something. Okay, so that is, yeah, it is skimming, which means fast reading. And what about scanning? Scanning, which means we are searching for some important keywords from each of the text. Okay, important words, underline important words, not the keywords, just underline the keywords, okay? It's important. And you have to underline, yeah. Okay, so coming back to this particular material, molar pregnancy, let's read. Okay, what are the keywords? Let me know in the comment. What are your keywords from text A? So, as we know, we have 4 different texts, text A, text B, text C and text D. And one of the texts will be a pictorial. As you can see here, text D is a pictorial. Okay, so what are the keywords from text A? Okay, so B, Reshma, Litty, Shiny, what are your keywords from text A? Let me know in the comment. Okay, so what are your keywords from text A? And you guys know about the 13 keyword strategy that we follow, right? Okay, so yes, what are your keywords from text A? May I know what are your keywords from text A? So once again I'll repeat, keywords, which means you can mark all the heading. Okay, then second, all the subheadings, all the numbers, all the signs and symbols, all the names, all the abbreviations, short forms, okay, and all those things which is mentioned in brackets, so which means all the brackets, then italicized or bold words, okay, then the words that indicate time showing words, then the words that can connect with or associated with experiment, then the words can be connected with research related words, okay, as well as the first line of each and every paragraph, as well as the last line, plus all the bullet points. Okay, so that's all about the 13 keyword strategy that we will follow. Okay, so yes, what are your keywords from text A? So please go through text A, skim read and underline the keywords. So here, a molar pregnancy occurs when an egg and sperm join incorrectly at fertilization and create a non-cancerous tumor. The tumor looks like tiny water-filled sacs like a cluster of grapes. The tumor cannot support a developing embryo and the pregnancy ends. Some people have a miscarriage. If this does not happen, surgery is needed to remove the pregnancy. If left untreated, molar pregnancies can cause serious complications. Then, molar pregnancies are a type of gestational trophoblastic disease. Gestational trophoblastic disease, that is GTD, okay, is a group of conditions that cause tumors to grow in your uterus. Okay, then molar pregnancies are also called 𝐻𝐻𝐷 moles. Then you are more likely to have a molar pregnancy if you. So what are the chances? So these are the chances. Okay, so what are your keywords from here? So these are all bullet points. You don't have to mark it, but still just give a special focus to all the points here. So I'm just marking from the first para this particular name, molar pregnancy, then egg and sperm, okay, any other words? Let me know in the comments what are your keywords from text A. Okay, Reshma, heading, actually there is no heading, right? Yeah, okay. Tumor, okay. Water filled sacs, very good. Yes. Complications, HTD. Okay. All numbers. Okay, so what are the numbers mentioned? 20, 40, 1 in 1000, 1%. So when you mark a number, always mark that symbols also. 1%. Okay, we can't say 1%, it is 1%, whatever. Yeah, that percentage symbol should be there. Then gestational trophoblastic disease, or that GTD. Okay, so then uterus, then 𝐻𝐻𝐷 moles, then anything else? Okay, a very big list is here by Sobi. Okay, egg and sperm, fertilization tumor, water filled sac, grapes, okay, yeah. Then embryo, miscarriage, complications, GTD, group, okay, the same different word, and that is cold. Okay, that name is mentioned here, 𝐻𝐻𝐷 moles. Then age 20, 40, 1%, 1 in 1000. Yeah, very good. Okay, okay, Anita, GTD, the same words. Okay, all right. Then what about text B? Any different words from text B? What are your keywords from text B? Hi Jyoti, good afternoon dear. Okay, yes, what are your keywords from text B? So we have a subtitle, not a, I can't say it is a subtitle, but still, yeah, different types mentioned. Okay, molar pregnancies fall into 2 categories. Yeah. So 2 categories, complete and partial. So what is complete and what is partial? That is explained in this particular text. Okay, so what are the other keywords from here? So embryo, then fertilizers, egg, Okay, then that's brackets, it is tumors. Then hormone HCG, or that's human chorionic gonadotropin. Then what else? Placenta, during, that word which indicates time. Then what else? Positive. Okay, then again placenta, embryo, tube, okay, egg, as well as chromosomes. Then develop, okay, survive, contain, chromosomes. Then 23, 69, embryo, again chromosomes, 2. Okay, so these are the keywords from text B. 2 categories, okay, HCG, chromosomes, embryo, fertilizers, okay, complete, partial, okay, very good, very good. Yeah, exactly. And coming to text C, so we have a heading here, that is signs and symptoms. So what are the signs and symptoms? Just go through it, okay? I don't want you to mark it, just go through, and if you have noticed any abbreviations or numbers, anything, you can mark it. Okay, so some people do not have any symptoms. Dark brown, bright red, bleeding from the vagina during the first 3 months. Okay, 3. Yeah, then first and 3. Okay, sometimes. Then pelvic pressure. Okay, then what else? Yeah, HCG, that abbreviation is mentioned. Hyperparathyroidism, right? Sorry, hyperthyroidism, not hyperparathyroidism, hyperthyroidism. Overactive thyroid, ovarian cysts, okay, preeclampsia, okay, 20 weeks before. Yeah, so these are the keywords from text C. Then, as well as first 3 months, okay. Then what about text D? So here we have a diagnosis. It is a pictorial, so diagnosis. And whatever numbers mentioned, yes, greater than 35 mentioned, 8 weeks mentioned here. And also you can mark all the abbreviations. Beta, HCG, 1%, X-ray, 2 years, again HCG. Okay, 2 weekly serum. Hysterectomy, name of the surgery. Okay, so these are my keywords from text D. Yes, so now we are moving to the first question. Okay, yes. Hi Anna, good afternoon. Okay, so yes, first question. Okay, so read the question, underline the keywords from the question, then tell me what is your answer. Okay, hi Adira, Sarala, good afternoon guys. Yes. Okay, so what about first question? Any idea? First one. Okay. Yes, Tindu, good afternoon dear. Yes. So did you all do this material? How was part A? This 1 to 7 set of questions. Was it easy? Okay. So a lot of answers. Okay, I'll read the answers. Joycey, Sobi, Reshma, Angel, Anita, Vaishnavi, Tindu. It's text D, right? Very good. Your answer is correct. It is from text D. So the invasive management which means what? Surgery. Okay, so invasive management which means the surgery they are asking you. So invasive management, admonished. What do you mean by admonished? Okay, admonishing someone which means we are recommending something. So the surgery management recommended for young patients enduring molar pregnancy. So that answer is from text D. So first question, invasive management or the surgery which is recommended. Admonished which means recommended, right? Okay, so which is mentioned in text D. So what is the surgery mentioned there? What surgery is mentioned? Okay, already we have marked, that is hysterectomy mentioned. So answer is from text D. Very good. Okay, Anna, yes, Adira, it is text D. Invasive, admonished, young patients. Okay, dear, very good, very good. Second one, how does complete molar pregnancy differ from partial molar pregnancy? It's a very easy question, right? Okay, differ is the only word I am marking. So this difference is mentioned, the 2 types mentioned, complete and partial. Where is it mentioned? Any idea? Which text is it is from? Okay, Joycey, okay, Reshma, Sobi, Ashwati, Vaishnavi. Any other answers? Yes, Angel. Okay. Okay, Atira. It is from text. Okay, Anita. Tindu. Okay, the only word is differ, right? Okay, fine. Okay, Sarala. It is from text B. Very good. It's a very direct answer. So text B is all about this two category differences. Two categories, complete and partial. Very good. So which is from text B. Then third one. Okay, Anna. Yes, Atira, Deepu. Good afternoon, dear. Yes. Okay, it's from text B. Then what about the third one? The sort of hemorrhage transpires in women as a symptom of molar pregnancy. Any idea? The sort of, which means that kind of, the nature of, yeah, you can say not kind of, I can say the nature of. Okay, so sort of, which means the nature of hemorrhage, that is bleeding, right? Transpires in women. So what do you mean by transpires in women? Any idea? Transpires in, it is transpiring in us, which means that is occurring in someone, happening. So that is transpires. So sort of hemorrhage transpires, which means I can say the nature of bleeding occurs in women. Simply I can say that. Okay. Yeah. So what is that correct answer there? Okay. Okay, Lena. Yes, starting with a lot of correct answers. Okay. Yes, Sobi, Ashruti, Angel, Vaishnavi, Tintu, Kartika. Hi. Okay, Anita, Joycey, Lena, Atira, Reshma, Atira, Kunyamon, yes, Sarala, Anna, Joseph. Okay, it is from text C. So that is the nature of hemorrhage. Okay, that is from text C. Yes, dark brown or bright red bleeding. Okay, so that is from text C. All right. Then fourth one, who are more susceptible to molar pregnancy? So susceptible, which means, what is the meaning? Vulnerable. Okay, very weak. So that is susceptible. So who are more susceptible to molar pregnancy? So what about that one? Vulnerable patients. Very good, very good. Excellent. So that is from text A. As you can see here. So you are more likely to have a molar pregnancy if you comes under these three categories. So that is all about, yes, text A. Then fifth one. Okay, so what about the answers? Okay, Joycey, Reshma, Vaishnavi, Sobi, Ashruti, Tindu, Angel, Adira, Sangeeta, Leena, Anita, Sarala, Sheena, Shasina, Adira. Okay, very good. It's from text A. A lot of correct answers. Okay, Ashruti. Then what about fifth question? Already you guys got the correct answer, right? Oh my god. Okay, so fifth one, the aggregate integer of chromosomes in partial molar pregnancy. So aggregate, which means the total. Okay, the integer, which means the number. So total number of chromosomes in partial molar pregnancy. Even though you guys have no idea regarding the meaning, but still other keywords will help you to find out the correct answer, right? Okay, so aggregate integer, which means the total number. Then chromosomes. So these are my keywords from the question. So where is it mentioned, the total number of chromosomes? Yeah. And that's mentioned here in text B, second last para. It is 23 chromosomes, 69 chromosomes, something. Okay. So that is from, okay, which is from text B. Very good. Okay. Again, a lot of correct answers. Adira, okay, Ashwati, Sobi. Okay, Joycey. Okay, Anna, it is from text B, dear. It's not from text A, it is from text B. Okay, Vaishnavi, Tintu, Angel, Adira, Anita, Reshma, okay, Leena, Sarala, Aisha. Okay, it's from text B. Then what about sixth one? How predictable is molar pregnancy? Predictable, here the meaning is how typical. Okay, how common? Yeah, how common is molar pregnancy? How common it is? Where is it mentioned? How common? Okay, so how common the condition, I mean the prevalence, yeah, it's all about in text A. So less than 1% of all pregnancies, about 1 in 1,000, okay, are molar pregnancies. So that is from text A. Are you guys there? Okay. Yes, Ashwati, Atira, Kunyamon, Anita, Vincent, Reshma, Sajeev, Sangeeta, Shaji, Angel, Jaimon, Vaishnavi, Prakash. Okay, Atira. Yes, Tintu, Sobi, Aisha, Joycey, Sarala. Okay, very good. Excellent. Next day. And seventh one, an expression employed to exemplify, describe, okay, an overactive thyroid. So what is a term? Expression, which means term, not that expression. Yeah, term. T-E-R-M, term. Okay, employed, used to exemplify, describe an overactive thyroid. So what is it? Hyperthyroidism. Yeah, I remember. That is from text C. Very good. Okay, so which is from text C? Yes, hyperthyroidism. That was my keyword, right? Yes. Okay. Anyone with 7 out of 7? Anyone with 7 out of 7? A lot of correct answers. Okay. Yes. Okay, Ashwati, Reshma, Vaishnavi, Atira, Angel, Sobi, Tindu, Anita, Anna, Aisha, Atira, Joycey, Sarala. Okay. Okay. Excellent. Okay. A lot of 7 out of 7. Oh my god. Okay. Pretty good. Okay. Okay. Okay, Joycey, Anita, Sobi, Angel, Aisha, Tintu, Ashwati, Reshma. Very good. Excellent. Okay. So yes, moving to the next set of questions, which is 8 to 14. Short answer questions. Okay. Yes. Okay, Adira. Okay. Sangeeta. Okay, Jobina. Very good. Very good. Okay. Yeah. 8th one. The presence of which hormone? So we need which hormone? In the placenta during the molar pregnancy get you the false hope of being pregnant. Any idea? Which hormone? The presence of which hormone? So that answer is very good. Answer is HCG, because that abbreviation is already mentioned there. So you don't have to write that full form. Just write the abbreviation. Okay. Yes. Answer is from text B. It is HCG. Okay. So yes, it is HCG. The placental tissue grows but is abnormal and contains fluid-filled cysts or tumors. This tissue produces the pregnancy hormone. That hormone is HCG. Alright. Then 9th one. Okay. Oh, you all got the correct answer. Okay. Okay. Okay, Joycey, Ashwati, Sobi, Jobina, Tintu, Vaishnavi, Anita, Angel, Reshma, Sangeeta, Atira, Deepu, Anna, Joseph, Leena Das, Aisha, okay, Sarala, Ashwati. Okay, okay. Then 9th one. In which phase of pregnancy proceed with the discharge of dark brown or bright red bleeding from the vagina? So dark brown, red bleeding, already we know that it is mentioned in that which text? Okay, from the signs and symptoms. Yes. Okay, so first 3 months. Answer is first 3 months. Okay, very good. Yes, a lot of correct answers. Yes, 9th one, in the first 3 months. So answer is first 3 months. Okay, okay. Then 10th one, a term that can be used substitute for molar pregnancies. What is another name? Not another name. Yeah, what is cold? Yes. Okay, substitute for molar pregnancies. What is the name? Okay, any idea? Which text it is mentioned? High dated form. Okay, moles, which is from second, okay, paragraph. Yeah, text A. High dated form moles from, yes, that is another name for molar pregnancy. Okay, HYDATIDIFORM. Okay, so that is the correct answer. Very good. Okay, a lot of answers. Okay. Then 11th one. The number of chromosomes in the egg during a complete molar pregnancy. Number of chromosomes. Okay, so there they've mentioned about 2 numbers. But here you should be very careful. Number of chromosomes in the egg during complete molar pregnancy. Yeah. 11th one. Any idea? 11th one. Where is it mentioned? Okay, 0. So, here molar pregnancies contain an imbalance of chromosomes. In a complete molar pregnancy, that is the keyword from the question, egg contains 0 chromosomes. 0 is the answer. Z-E-R-O, 0. 0 is the answer. Yes. Okay. Okay. So that 0 is the correct answer. So just write it there, not that integer, just write the word Z-E-R-O. Okay, so that is what I mentioned there. Okay, Shruti, Sobi, Vaishnavi, Atira, Tintu, Jobina, Anita, Angel, Lena, Aisha. Okay, Lena, it's not 23, dear, it's 0. Okay, yeah. Okay. Then moving to the next question. Yes, 12th one. A condition that causes high blood pressure and protein in the urine before 28 weeks of pregnancy. So my keyword is before 20 weeks of pregnancy. A condition. So what condition? Preeclampsia. Yes. Okay. And where is it mentioned? It's here. Preeclampsia, a condition that causes high blood pressure and protein in the urine before 28 weeks of pregnancy. So that is preeclampsia from text C. Yes, a very direct answer. 13th one. The type of disease which molar pregnancies belong. Type of disease. What type of disease? Okay. It is gestational trophoblastic disease. Either you can write what? The abbreviation is mentioned there, right? So that is GTD, which is mentioned in, which text? Here. Okay, so GTD is mentioned here. Yeah. A lot of markings, so I'm just striking it off. Sorry, rubbing. Okay, so that is gestational trophoblastic disease, or GTD is the answer. Right? Okay. Okay, everyone got the correct answer. Okay. Gestational trophoblastic. Okay, so be gestational trophoblastic disease. You can write that GTD. Okay, if you are writing the full form, you can write the name also, because that is a name of a disease condition. So you have to write disease also. It is a name of a disease condition, GTD. You can't separate it, right? So you can repeat the same. Okay. Answer is gestational trophoblastic disease. Okay. Then 14th one. Which would be the best management for women who deciding sterilization? So keywords, best management, sterilization. Any idea? Which would be the best management? Yes. Very good. Answer is, what is the correct answer there? It is hysterectomy from, okay. Which text? Where is it mentioned, hysterectomy? That is mentioned in text D. Okay, hysterectomy should be the answer. Okay, so where is it? Yeah, here. That is the only surgery, hysterectomy. Okay, so women deciding sterilization, the previous bullet point, see? Okay, so answer should be hysterectomy. Yes. Okay, so completed 14 questions. So now we are moving to the last set of questions, which is 15 to 20. Fill in the blanks. Okay, a partial molar pregnancy materializes as an dash. Okay, forms accompanying an embryo and 2 sperm fertilize 1 egg. Any idea? 15th one, abnormal placenta. Very good, very good. Okay, Shruti, yes, Adira, Joycey, Anita, Reshma, it is abnormal placenta. Okay, Vaishnavi, and where is it mentioned, abnormal placenta? So my keywords, materializes, then accompany, as well as embryo. Okay, answer is abnormal placenta, which is mentioned in text B. Okay, so where is it mentioned in text B? In complete molecular pregnancies, no embryo forms. Okay, so that is the first para. So second para, in partial molar pregnancy, yeah, that is a keyword, occurs when an abnormal placenta forms along with an embryo and 2 sperm fertilize 1 egg. So answer is abnormal placenta. Right? Okay. Yeah, a lot of correct answers. Yes. Okay. Okay, Jobina, Aisha. Okay, Anita, Lena, Angel, Sarala. Okay, Sobi. Yes, it is abnormal placenta. Then what about 16th one? Occasionally. Okay, which means sometimes, not, yeah. So occasionally, sometimes cysts which take after dash may get discharged from the vagina that stipulates molar pregnancy. So what about that one? It's from text A, very direct answer. Okay, so what is it? Any idea? What is it? 16th one. 16th one. Okay, I'll read the question once again. Occasionally, sometimes, cysts which take after dash may get discharged from the vagina that stipulates molar pregnancy. Sometimes. What is it? Okay, Sobi, I didn't get that answer. Okay, I was stuck there. Okay. Any idea? Okay, so lot of answers. Fertilization. Where is it mentioned? May I know? Where is this fertilization mentioned? Which text? Okay, occasionally cyst which take after dash. So, okay, sometimes, okay, what do you mean, where is it mentioned fertilization? Very good, only one got the correct answer, okay? Yes, Jobina, your answer is correct, okay? Answer is grapes, okay, which is mentioned in text A. Answer is grapes. Okay, so the tumor looks like tiny water-filled sacs like a cluster of grapes. Okay, then the tumor cannot support a developing embryo and the pregnancy ends. Some people have a miscarriage. If it does not happen, surgery is needed to remove the pregnancy. If left untreated, molar pregnancies can also cause serious complications. So answer is grapes. Okay, and sometimes it is mentioned somewhere else. I think it is from text C also. Okay, it is mentioned about grapes, yes. Yes, sometimes grape-like cyst that pass from the vagina. So that is grape-like. It is grape. Answer is, you can write grape. Okay, yes, not grape-like. We can say, you can just write it there, grape. Okay. Okay, so that is grape. Sometimes, which means occasionally. So that is exactly from text C, I can say, not from, yeah, text A will give you a small clue, but text C, it is the direct answer. Okay, sometimes grape-like cyst that pass from the vagina. So that is grape. Okay, it's okay, okay, one question, right? Then 17th one, gestational trophoblastic disease is a contingent of maladies that precipitate dash to grow in your uterus. What about that one? Okay, 17th one, GTD, contingent maladies. Maladies, which means the complications, problems. Okay, tumors, very good. Answer is tumors, again from text A. Yes, it is mentioned here. Kanda. Okay, in text A, GTD is a group of conditions that cause tumors to grow in your uterus. So that answer is tumors. Okay, then 18th one. The tumor formed out of molar pregnancy looks like a tiny dash similar to a cluster of grapes that can support developing embryo and the pregnancy ends. Okay, and that is from text A. Answer is water-filled sacs. Okay, so when you write water-filled sacs, water-filled sacs should be there. Okay, okay, Akku, it is water-filled sac. Okay, dear. Okay, Shruti, yes, Reshma, very good, very good. It's water-filled sac. Then question number 19, monthly follow-up with beta HCG and pelvic ultrasound for a period of 2 years can be followed dash if we must rule out metastatic disease. What about that one, 19th? Okay, so which is in text D, I guess. Okay, so answer is chest X-ray to rule out metastatic disease. So answer is chest X-ray. Okay, and the last one, we could notice a condition called preeclampsia that causes a high blood pressure and protein in the urine before dash of pregnancy. What of pregnancy? Okay, and that is from symptoms. Yes, what of pregnancy? 20 weeks. Okay, so before dash of pregnancy, which means 20 weeks is the correct answer. Okay, a lot of correct answers. Okay, Sankita, Akku, Aisha, Reshma, Atira, Sarala, Tintu, Vaishnavi, Leena. Okay, Sobi. Yes, Joycey. Yes. Okay, 20 weeks. Okay, so that's all about today's material. So any doubts? Or may I know in the comment how many of you got 20 out of 20? I hope not 20 out of 20, 19, right? Because yes, you missed one question, 16th one. Okay, 20. Okay, Sobi, very good. Okay, Aisha. Okay, Reshma, 19. Okay, Angel, 19. Okay, Jobina, 19 in 30 minutes. Very good. Okay, Sangeeta, 18. Okay, Adira, 19. Okay, Akku, 19. Excellent. Okay, 19. Okay, Tindu, 18. Very good, very good. Okay, Vaishnavi, excellent. Yes, good enough. Okay, so that's all about today's session. So, God bless you all. Take care. See you tomorrow.